So this blends the world of injury rehab and performance training. It's all the same. It's all threat management, really. So first case to go through on performance positioning is working with nerve mechanics. So this particular case, Katherine, 53-year-old female equestrian, she's an endurance rider. Okay, she loves horses her whole life. For the last 15 years, she's been an endurance rider. So she came to us with pain in her right ankle and hamstring and low back pain after riding more than 90 minutes. Those are her two primary complaints. And like some of the photos that I picked out here, she had difficulty standing up in her stirrups. And she wanted to be able to do this because her low back is hurting so much. But she pops up on that stance. And I'm like, okay, that looks like a right PMRF pattern showing up in postural activation, external rotation. You can see it comes all the way from the hip, right? Her ankle is in that right, like tibial nerve tensioning position of dorsiflexion and eversion. And I'm thinking maybe some otolith of that issue, like when she was drifting during her walk, she's all weight shifted over to her left side. Pull her off of the saddle, put her in a chair, teach her tibial nerve slacking. Then once she does that and she can do the shape and do the drill, then we put her back on the saddle. And this was kind of cool because when she's in the saddle, what ended up happening is to get into the tibial nerve position, all she has to do is take that right leg and lift it as if she's going to be getting off the horse. Pick the leg up, lift it up over the neck. All she needs to do is point her toes and she's slacking that tibial nerve. Now, maybe you think the same thing, I don't know. But think about the muscle activation that's happening to get the leg into this position. If you're going to activate musculature to help stimulate the PMRF from the lower body, what would you want to activate?
Flexors and adductors.
Adductors,
Yeah,
and possible internal rotators. It's not an exact match because you still have the external rotation happening at the hip, but you have enough to watch her in actual motion here. The immediate reassessment ends up looking like this. I don't have a picture of this one because I couldn't find a great image, but I tied an elastic band to her saddle stand, wrapped it around her right foot and ankle. So she's just doing like basically straight leg kicks and then knee extension kicks with that right leg to get some more activation through that anterior musculature of the leg. Because she's a very, very much bottom up kind of client. We're making big changes, and then we worked our way up where we could do pelvic tilts in the saddle, we could do lumbar movement on the saddle, and then eventually we did all of her vestibular work there too.